Attention deficit disorder. Attention hyperactivity disorder is a spectrum of conditions with many genetic causes. ADHD features inattention, hyperactivity and impulsiveness, conditions we all have from time to time. It's a wide variety of related disorders whose diagnosis and treatment have been controversial for decades. Opinions range from not believing it exists to believing there are genetic and physiological basis for the condition to disagreement about the use of stimulant medications in its treatment. Or the condition is a fraud perpetrated by the psychiatric and pharmaceutical industries on families anxious to understand a range of behaviors in the young we all have from time to time. Some believe ADHD is a classic example of medicalization of deviant behavior by redefining a previously non-medical problem as a medical one. About 9.5% of American children 4 to 17 years old were diagnosed with ADHD as of 2007. That's 5 million children. The parent-reported diagnosis of the disorder increased by 22% between 2003 and 2007. ADHD is estimated to cost between $36 billion and $52 billion a year, and $12,005 to $27,458 per year per individual. Many different genes cause attention deficit disorder. ADHD. ADHD arises from a combination of genes. It is a polygenetic or multifactorial disorder. Many of the genes affect dopamine transporters, and no single gene has been shown to make a major contribution to ADHD. ADHD has also been linked to iodine deficiency. Studies of twins show genetics is a factor in 75% of the cases. The disorder is not a social construct or fraud, but the overprescription of stimulants is a problem. Some of the genes that are associated with attention deficit disorder ADHD: 2-adrenergic receptors. The alpha-2 adrenergic receptors are encoded by ADRA2 gene. These receptors regulate neurotransmitter release from the central nervous system. Dopamine transporter is a cell membrane spanning protein that pumps the dopamine back into cytosol. Dopamine receptors are implicated in many neurological processes: motivation, pleasure, cognition, memory, learning, and fine motor control. Abnormal dopamine receptor signaling and dopaminergic nerve function is implicated in several neuropsychiatric disorders. DAT1 gene is a membrane-spanning protein that mediates the reuptake of dopamine from the synapse. It has been associated with bipolar disorder and ADHD. DRD4 gene is activated by the dopamine. It is linked to many other neurological and psychiatric conditions. Dopamine beta-hydroxylase gene DBH. TARCI, association between the dopamine beta-hydroxylase gene, DBH, TARCI2 and childhood ADHD. LPHN3 gene, latrophilin 3 is a protein encoded by the LPHN3 gene. It confers susceptibility to ADHD, and predicts effectiveness of stimulant medication. HTR2 gene, variations of receptor gene HTR2 contributes to seasonal affective disorder and ADHD. Environmental causes of an ADHD cases is non-genetic in about 9 to 20% of cases. The causes: premature birth, smoking during pregnancy, fetal lack of oxygen, streptococcal bacterial infection, measles, varicella, rubella, enterovirus, pesticides like organophosphate chlorpyrifos, exposure to lead in old buildings, fixtures, paint, head injuries, alcohol or drug use during pregnancy, mercury, magnesium, aluminum poisoning, sniffing.
G solvents.